Good morning, teachers. During my workshop this morning, we are going to be looking at poisoning in children. Poisoning is an injection of harmful substances into the human body. Poison can be intentionally absorbed, swallowed, or even injected into the body. Vulnerabilities. Children under 5 are at high risk and vulnerable to poisoning incidences because they swallow or eat toxic substances thinking it is food. Types of poisonings include strong acids, bathroom drain cleaners, battery acid, dishwasher soap, ammonia bleach, coal remover, petroleum jelly, products such as gasoline, kerosene, and lamp oil, flour, wax. Others such as medicine, cosmetic products, insecticide, weed killer, nail polish removers. Those all include as types of poisoning substances that the teacher should know. Some of the signs of poisoning include this: nausea or vomiting, abdominal cramps, unusual breath odor, skin that feels cold or clammy, burns or visible stain around the mouth, lips or tongue, listlessness and confusion, difficult breathing, confusion and loss of consciousness, and seizures. These things that we list here, teachers can be able to know them so that if they are suspecting any child in a class that can be having issues for the poisoning, they can be able to look for these signs. Treatments. The treatments will depend on types of substances injected. Therefore, it is important to know the name of the toxic substances, how much injected, and what time. If the child is suspected of poisoning, quickly assess redness or burn around the lips, mouth, and tongue. On assessment, if there is sign of burn or redness, it is an indication of chemical poisoning, usually caused by strong acids. In this case, do not give anything to eat to the child or even drink. Do not make child vomit because burn can be complicated further. Smell child breath odor, and if the poisoning substance is a petroleum product, the child breath odor will smell like gasoline or kerosene. If the child is conscious, try to locate the container to know which types of poisoning substances injected, the time and how much if possible. If you cannot locate the container, do not delay. Call Poisoning Control Center at 1-800-222-1222 or your city's 911. Observe child closely for choke and difficult breathing. If the child is unconscious, call 911 immediately. Position the child inside lying to prevent choking. In case child breathing stops, admire CPR. Always check with Poisoning Control Center for instruction before you attempt to give any treatment. The last thing the teacher should know is that you should be able to contact families of child as soon as possible when you are suspecting this all into the child. Thank you. This was my presentation this morning.